Do you ever feel like something's not quite right with your body, but you can't put your finger on it? Sometimes the smallest signs could be warning you about something serious. In today's video, we'll reveal 8 early cancer signs that could make all the difference in catching the disease early. From unexplained weight loss to persistent pain, these signs might be your body's way of telling you something important. Don't ignore them. Your health might depend on it. Stay tuned and subscribe to our channel to stay informed and protect yourself. Unexplained weight loss. Unexplained weight loss is often an early sign of cancer that many people overlook. If you've lost 10 pounds or more without trying, meaning no change in diet, exercise, or lifestyle, it's essential to take note. This type of weight loss can be linked to cancers of the stomach, pancreas, esophagus, or lung. Cancer cells can change how your body uses nutrients, leading to weight loss even when you're eating normally. It can also occur due to increased energy demands from the cancerous growth, or as a result of changes in metabolism. Other conditions like thyroid issues or gastrointestinal problems can also cause sudden weight loss, so it's crucial to get a thorough medical evaluation. Even though non-cancerous conditions might result in weight loss, it's best to rule out significant causes as soon as possible. If you experience unexplained weight loss, especially with other symptoms like fatigue or loss of appetite, consult your doctor immediately. Early detection of cancer can greatly improve treatment outcomes. Persistent fatigue. Persistent fatigue is a common but often underestimated early sign of cancer. This type of exhaustion goes beyond normal tiredness and doesn't improve with rest. Cancer-related fatigue can occur due to the body's response to the growth of cancer cells. The immune system becomes overworked, using up more energy to fight the disease. Cancers like leukemia or lymphoma are particularly associated with fatigue due to changes in blood production or the spread of cancer cells. Additionally, cancers that cause internal bleeding, like colon cancer, can lead to anemia, which further drains energy levels. The fatigue may feel overwhelming, affecting daily activities, work, and concentration. While many factors, such as stress or poor sleep, can cause tiredness, persistent and unexplainable fatigue should never be ignored. If you find that fatigue is affecting your life and there's no clear reason for it, it's important to see a doctor. This symptom, when combined with others, could be an early indication of cancer that requires prompt investigation. Changes in skin appearance. Changes in skin appearance can be an early sign of cancer, especially skin cancers like melanoma, basal cell carcinoma, or squamous cell carcinoma. These changes may include new growths, sores that don't heal, or changes in the color, size, or shape of a mole. Melanoma, the most serious type of skin cancer, often starts as a dark spot or mole that grows unevenly, has irregular borders, or changes color. Non-melanoma skin cancers may appear as raised, red, or scaly patches that itch or bleed. Other cancers, such as liver or pancreatic cancer, can cause jaundice, the yellowing of the skin and eyes. Additionally, some internal cancers may cause darkened skin, redness, or rashes as a result of the body's response to the disease. It's crucial to monitor any new or unusual skin changes and consult a doctor if something looks suspicious. Regular self-examinations and prompt medical attention can help detect cancer at an early, more treatable stage. Skin changes can sometimes be a visible clue to hidden health issues. Persistent cough or hoarseness. A persistent cough or hoarseness that doesn't go away could be an early warning sign of cancer, particularly lung, throat, or laryngeal cancer. While many coughs are due to common illnesses like colds or allergies, a chronic cough lasting more than 3 weeks should not be ignored, especially if it worsens over time. In the case of lung cancer, the cough might be dry or produce blood-streaked sputum. Persistent hoarseness, on the other hand, could indicate a tumor affecting the vocal cords or surrounding tissues. Smokers or those with a history of smoking are at higher risk, but non-smokers can develop these cancers as well. Sometimes a cough can also signal cancers that have spread to the lungs from other areas of the body. Difficulty breathing or chest pain accompanying the cough can further signal something serious. If you have a lasting cough or hoarseness, especially with other symptoms like weight loss or difficulty swallowing, it's important to consult a healthcare professional to rule out or catch cancer early. Unusual bleeding or discharge. Unusual bleeding or discharge can be an early sign of cancer and should never be overlooked. Different types of cancer may cause various forms of abnormal bleeding. For example, colorectal cancer can lead to blood in the stool, while bladder or kidney cancer may cause blood in the urine. In women, abnormal vaginal bleeding, particularly after menopause, may signal cervical, uterine, or ovarian cancer. For men, blood in the semen can indicate prostate cancer. Persistent nosebleeds or bleeding gums may also be linked to blood cancers like leukemia. Discharge from the nipples, especially if bloody, could be an early sign of breast cancer. These symptoms occur as tumors grow, causing irritation or damage to tissues, or when cancers affect blood vessels and surrounding areas. While not all abnormal bleeding is due to cancer, it's a serious symptom that warrants immediate medical attention. Early diagnosis can make a significant difference in treatment outcomes, so if you notice any unexplained bleeding or unusual discharge, consult a healthcare professional promptly. Difficulty swallowing. Difficulty swallowing, or dysphagia, can be an early symptom of cancer such as esophageal, throat, or stomach cancer. This condition may start as a mild discomfort, but can progressively worsen, making it hard to eat or drink. You might feel food getting stuck in the throat, or experience pain when swallowing. In some cases, this difficulty arises from tumors that grow inside the esophagus or nearby areas, causing a narrowing of the passage. Throat cancer can also lead to swallowing issues due to swelling or tumors that affect the muscles responsible for this function. Additionally, stomach cancer may press on nearby organs, making swallowing difficult or uncomfortable. This symptom can lead to weight loss, as people tend to eat less due to discomfort, and can also increase the risk of malnutrition. While other non-cancerous conditions, such as acid reflux or esophagitis, can also cause swallowing problems, it's important to seek medical attention if this symptom persists. Early detection of cancer when swallowing issues arise can improve treatment outcomes. Persistent pain. Persistent, unexplained pain can be an early indicator of cancer, depending on its location and severity. Pain can occur when a tumor presses on nearby organs, nerves, or bones. For instance, a continuous headache may suggest a brain tumor, while persistent back pain could signal cancers of the spine, pancreas, or kidneys. Bone pain, particularly in the legs or arms, may be linked to bone cancer or cancers that have spread to the bones. Cancers affecting the stomach, liver, or ovaries can cause abdominal pain. In certain instances, the body's reaction to the cancer may also create internal inflammation, which can cause pain. While pain is more commonly associated with advanced stages of cancer, it can also be an early sign, particularly when no other cause is apparent. Unlike temporary aches, cancer-related pain tends to persist, intensify, or be resistant to common painkillers. If you experience continuous or worsening pain with no obvious reason, it's important to consult a doctor for further evaluation. Early diagnosis can significantly improve the chances of successful treatment. Changes in bowel or bladder habits. Changes in bowel or bladder habits can be an early warning sign of cancer, particularly cancers of the colon, rectum, or bladder. For bowel-related issues, watch for persistent constipation, diarrhea, or a change in the size or consistency of stool. Colon cancer, for example, can cause narrowing of the stool due to blockages in the intestines. Additionally, blood in the stool or black tarry stools can indicate gastrointestinal bleeding, a potential sign of colon or rectal cancer. Bladder cancer may lead to blood in the urine, increased urgency, or difficulty urinating. Frequent urination or the sensation of incomplete bladder emptying can also be linked to prostate cancer in men. While a number of non-cancerous illnesses, such as infections, nutrition, or stress, can cause changes in the bowel or bladder, persistent alterations lasting longer than a few weeks should not be disregarded. If you notice any unusual bowel or bladder habits, especially with other symptoms like pain or blood, consult a healthcare provider promptly. Early detection significantly improves the likelihood of effective cancer treatment.